Located in West Africa, just north and west of Liberia, Sierra Leone is one of the poorest countries in the world. 70% of the 6 million population live below the poverty line. The per capita gross domestic product is $800 per year. By comparison, that of the United States is $42,000. 45% of the population is age 14 or less, and the life expectancy is only 40 years. Living conditions in Sierra Leone are hard. Many people have only one meal a day. Lack of clean drinking water is a major problem that contributes to poor health and many diseases. OC Ministries was created to improve the education of children in the poorest countries so that future generations are better able to improve themselves. OC Ministries began as Operation Classroom in 1987. In 2001, Operation Classroom's name was changed to OC Ministries as we expanded the scope of our efforts to also include clinics and churches. We recognize that we cannot just educate someone without making sure they are also healthy physically and spiritually.
While the healthcare infrastructure is greatly lacking compared to U.S. standards, that which is available in the crowded cities is far better than that in the small villages where the majority of the population now lives. In the early years of OC Ministries, clinic efforts were limited to supporting Amaneta Kamara in the Alma Clinic located in the Parsonage Building in McKinney. In 2005, an OC Ministries team that was constructing a new school building in McKinney made the first trip to Minoko. Minoko is a village of about 750, located about 6 miles off the main road. The people in this village are primarily dependent upon the land for their survival. Many were sick, as there was no working well in the village, and drinking water had to come from a nearby river. To obtain medical attention, it was necessary to walk 6 miles to the main road and flag a ride for the 12-mile journey to the town of McKinney. The OC Ministries team was struck by the living conditions they found in Minoko. The team's nurse was so taken by the situation she saw that she spent the next year putting plans in motion to address the medical needs she found. 1 year later, the same team nurse returned with another OC Ministries construction team to McKinney. A trip to Minoko was top on the list of stops to tell the village what had been arranged. A permanent medical clinic was to be established in Minoko that would be supported by OC Ministries and led by Amaneta Kamara.
And she will teach. She will teach the village worker how to take care of you.
So all we need to man people no so we one way oya we to take sako in mapi allow area to believe basi at better than
Nutrition. Sanitation. Hygiene. Simple, like malaria, things like that. So that's it.
So he has nothing to say anymore, just to thank you. So he wishes that you go back safely.
The village showed their gratitude by showering the OC Ministries team with many valuable gifts. Before the OC team returned to McKinney, they left money for a new well to be dug so the village would have a safe source of fresh water. Later that year, in September 2006, the nurse returned to Minocco to bring supplies and to see how well the clinic was operating. She found that Amanetta Kamara had trained the community health workers and even had uniforms made for them to wear in clinic. The weekly clinic focused primarily on dealing with the health needs of pregnant mothers and on children under 5 years old. When the nurse completed her short visit to Minocco, she knew the clinic was now ready to receive medical teams from the United States. In 2007, 2 medical teams consisting of doctors, nurses, and non-medical personnel came to work in the Minocco clinic for 2-week tours of duty. The first team arrived in January. Each day begins with everyone in the waiting room praying. First, the Lord's Prayer.
Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us.
And then a Muslim prayer. General healthcare instructions are given with singing to aid in remembering.